When we treat advanced non-small cell lung cancer, we continue a treatment, provided it is safe and well tolerated, until progression, until the treatment stops working, until there is growth. Immunotherapy has challenged this paradigm. Because of how immunotherapy works, because of its effect on white blood cells and how white blood cells attack a cancer, it could appear as though a cancer were growing, when in fact, with time, it would respond to that very treatment. As a result, some patients continue immunotherapy beyond the point of progression. Some recent data presented at ASCO suggested that patients continuing immunotherapy beyond the point of progression could continue to derive benefit. And while in some cases this is true, this is data that can be very easily misinterpreted. The data that were presented were retrospective from a study where people could continue immunotherapy if they met a very specific set of circumstances. When we treat advanced non-small cell lung cancer, we typically continue a treatment until the point of progression, provided it is safe and well tolerated. At the point of progression or tumor growth, we would consider that treatment ineffective and would discuss other options. Immunotherapy has somewhat challenged this paradigm. Because of the way that immunotherapy works, because of its effect on the white blood cells and how white blood cells attack a cancer, it could appear as though a cancer were growing when, in fact, over time, with continued immunotherapy, it could eventually mount a response. As a result of this, some patients continue treatment with immunotherapy beyond the point of progression. There were some recent data to support the use of this treatment beyond progression, suggesting that people who continued immunotherapy after progression could derive additional benefit. And while this can be true in certain circumstances, this data could be very easily misinterpreted. These were retrospective data from patients on a study who could continue treatment beyond progression only if a certain set of criteria were met. These were a very select set of patients in very specific circumstances with very experienced physicians. Not all patients should continue immunotherapy regardless of the results of a CT scan. We would continue immunotherapy under very specific circumstances if the pattern appeared to suggest continued treatment would be of benefit, only if the patient felt well, did not have new or worsening symptoms, and if the area of disease was not at a critical or dangerous location. But if it is clear that immunotherapy is not working, treatment should not be continued, and no one benefits from continuing to receive an ineffective drug.